Thank you, and I really appreciate this National Symposium for the cornea, which is a pleasure to talk in front of such stalwarts. So I'm going to talk about the newer thing in dry eye, and because of the paucity of time, I don't think I can talk about everything, but I would possibly stick myself to post-phase 3 and phase 3 trials which are going on. There are a couple of things which are already there in the market and which is just lurching at the horizon for us and might be available quite soon. One of them is Xiidra, which is levetiracetam from Novartis. This is a small molecule which prevents the T cell activation and prevents the adhesion, migration, and proliferation. And the best part is the onset of action is pretty fast. It's within 2 weeks, the onset of action is. Another thing which is available in US and which might be available pretty soon by Allergan is neurostimulation.
Toward the bridge of your nose. True to your tilt. Hold until tears pool. Remove to clean. Your preferred strength.
So basically, there are a couple of such kind of devices which are available externally. One of the devices available which can be applied externally. The other device, TrueTear, has to be put inside, and which helps us increasing reflex steering. Going to the next thing, post-phase 3 trial, there are a couple of molecules which are here. One of them is varenicline nasal spray, which is already there in the post-phase 3, and the data are analyzed. Basically, what's happening here is...
when administered within the nasal cavity, OCO1 activates the parasympathetic nervous system. Through binding to select cholinergic receptors on the trigeminal nerve, causing ion channels to open and a depolarization of the nerve. This further activates neurons within the central nervous system.
So both of them works on similar concept where they stimulate the nerve, whether using a pharmacological compound or using the pain stimulus. The another molecule which is in post phase 3 is called RGN-259. Basically, this is going to be utilized for neurotropic keratitis, which reduces inflammation, increases tissue regeneration, especially conjunctiva and the cornea. And we are waiting for all 3 studies, ARISE 1, 2, 3, and the results, earlier results were pretty encouraging. But as it happens in most of these things, sometime after everything, we may come back to that it doesn't work. Coming to the phase 3 trials, one of them, which is so most of now the molecules of cyclosporin are now trying to go into higher strength of cyclosporin, like 0.1% from 0.05%. One of them from Sun Pharma, it's called Sequa, which is 0.09%, and which is a nanomicellar technology, hence increasing bioavailability. Similarly, Santen has its own Icarus, which is there in Japan and also undergoing phase 2 and 3 trial in European Union, which is a cationic nano-emulsifying carrier, which is increasing the bioavailability of the same drug. Both of them are, mind you, unims. Another one, which is Cyclosol by Novalic, which is a multi-dose vial, but that uses very unique technology of isol, which reduces the drop size and it increases the ocular surface retention time as well as the bioavailability. And hence, maybe the effectiveness of this drop may be a little better. Another Loteprenal Suspension by KPI-121 from Gala Pharmaceutical. Now, this uses a mucus penetration particle technology, which allows the molecule to pass through the mucin chain and hence increasing the bioavailability. Again, the studies, STRIDE 1 and 2 trials are awaited results, and there are more than 900 patients studied there. Another molecule, tivanisiram by Silentis. This is basically, again, a small molecule nucleotide, oligonucleotide RNA. and which reduces the pain and symptoms of the dry eye. And again, the initial trial shows good outcome, but we need to wait for the longer results. Visometin by Mitalia is another molecule which is available in Russia and which is undergoing trial in US, and which reduces the oxidative stress and can possibly help in improving the dry eye symptoms and sign. Oxervate by Dompe Pharmaceutical, which is a recombinant human nerve factor, which helps us in neurotrophic keratitis and helps in the healing of these things. So with these things, there are the molecules which are there in phase 2 and phase 1 trial, but because of the paucity of the time, I'm not going to touch up. But let me tell you, the future of dry eye is very exciting, and there are a lot of new molecules which are going to come in the market soon. Thank you very much.
Thank you, Himanshu, for a nice futuristic thing. And